Hey, 420 investors. I'm very happy to have with me today Dr. Kyle Kingsley, who will be talking to us about his company's New York State application. How's it going, Kyle?
It's going well. Thank you very much.
I don't know that our audience knows that much about you, so I'll let you introduce yourself a little bit, but just from the big picture, I've been following your story really since right before Minnesota announced its winning dispensaries and cultivators. You won one of the two licenses there with what's called MinMed, more formally Minnesota Medical Solutions. And we'll talk more about that, but today we're going to focus on Empire State Health Solutions, which is one of 43 applicants in New York. But before we get into that, how did you stumble into this, Kyle?
Yeah, stumble indeed. If you had told me 2 years ago that I would be involved in medical cannabis, I would say that you were probably smoking a lot of cannabis because that's a big stretch for me. But some personal interests in horticulture, medicine, and business, and some personal experiences in the emergency department. I'm a board-certified ER doc. Led me to take a look at medical cannabis when Minnesota came up with a very medicine-focused, kind of a strict law. It was very appealing to my team and we decided to go ahead and put together an application.
And a successful one it was. For those that aren't familiar, the New York program is very similar to Minnesota. There were two companies that won licenses. Each has the, obligation to open 4 dispensaries. MinMed opened on time with 1 dispensary, if I'm not mistaken. And so the production was on time, and 1 dispensary, 3 more to come. Is that accurate?
Yes, that is correct. We are in Minnesota. We're opening our 2nd dispensary in Rochester, Minnesota. That's this week, actually Thursday, and we have 2 others that will be opening in rapid succession. So very similar to New York in that in the structure and requirements for manufacturers.
And if I'm not mistaken, you guys raised something like $17 million in Minnesota. Is that right?
That's correct. We raised $16.6 million in a few weeks, and we actually ended up turning away quite a bit at the end of that raise. We've been much more passive in New York because we are, we do have adequate capital to do what we need to do. That being said, there's always things that you can optimize, and we're really excited about building up our, redundant scientific apparatus and research and development wing.
And so I'm not exactly sure what you can say. I know that you're looking to raise up to a certain amount. If you want to say that amount, that's cool. But just for our listeners, you'll be able to get in touch directly with Kyle. I'll leave contact information. But can you talk a little bit about the PPM, or do you just want to reference the PPM?
Yeah, absolutely. So what I can say is that we are going to shut down this raise the minute we get the license, because obviously we can change the terms at that point. But we are looking to raise up to $30 million. And, we're well on our way. We're excited about the amount that we've raised and are confident that we are fully capitalized for New York. But it is an opportunity here in the next week or 2 for those that are interested. We are pretty selective in who invest, and we need the right fit for investors. We've had, a substantial number of investors, and we're very, very selective kind of who we bring on.
So for those that aren't really following, we've talked a little bit about how it's similar to Minnesota, but let's talk about some of the details of New York, and you can reference Minnesota as well. This is right up your alley, from what I understand. It's more of a science type of program as opposed to a Colorado-style program. There are going to be 5 different cultivators, each with 4 dispensaries, so kind of that same ratio as in Minnesota. It's all extract, no flower. What else do people need to know about New York?
Yeah, so there's very strict quality standards. There's a relatively restrictive patient population as far as those who will qualify for cannabis use initially. And very strict dosing is required. And like you said, it is an all extract state without the plant material. So it's very much a different beast than Colorado or California. And the difficulty, the magic is not the cultivation or the retail end of things. It's the methods, the scientific methodology in between there. And that was basically, in Minnesota, it took us the full amount of time to develop those. And it's something that, even if you're a full-fledged pharmaceutical company, you have to take the time to develop those methods. And it's not something you can do at short notice. So and we're excited about the New York regulations, and in particular, we're excited about the time frame because we are 100% certain we can meet that time frame and be the first manufacturer in the state of New York to get patients their medicines.
Yeah, a lot of people aren't real fans of the Minnesota program or the New York program because of extract only and limited patient population. But I have to say, I've followed a lot of these state implementations, and Minnesota was unbelievable. It was done on time. The New York timeline is very aggressive. They're supposed to award licenses maybe as early as the end of this month. And I know you believe that you can get up and running by that early January implementation, but is that a realistic expectation for most of the applicants?
I don't think it is. What I can say is we're actually ready to grow as of Thursday, this coming Thursday. So we are ready to begin cultivation. We've already started the sequence of events that, essentially from plant to, extraction to separation to formulation to the retail end of things. That's all been started. And, we're good at figuring out what the rate limiting step is. We've done that in Minnesota. And like I said, we're 100% confident that we can meet the New York timeline with time to spare.
So that's an awesome attribute to have, because I'm sure no state regulator wants to be embarrassed by their applicants.
Right on.
So one of the things that strikes me about New York is the economic estimates are not very good. A lot of people view this as a loss leader business, and the only way that these dispensary grow facilities can make money is if the conditions are expanded or the state moves towards legalization. Is that your view as well?
It is not. So I can say in Minnesota that there is a conservative adoption rate initially by patients, but it has been growing, I don't know if you've paid attention the last 2 weeks, quite dramatically. And so this will be a classic hockey stick, and I think it may even be a more prolonged hockey stick in New York, where you do have some barriers to entry. The systems have to be up and running. You have to get physicians on board in New York to be certifying patients, and you need to get patients comfortable with this. So I think that as it stands, the New York law is viable if a business is able to control their burn rate and approach this in a stepwise phased fashion, which is exactly what we're doing. We've learned in Minnesota, we've developed these methods in Minnesota, and we don't have to recreate the wheel. We can very much minimize our burn rate and survive the first several months or year to get to profitability in New York.
Well, that's an interesting perspective, because it definitely takes a lot of money. You've said you're looking to raise $30 million. I've heard some really big numbers out there. And also, you have some pretty formidable competitors, potentially, at least on paper. 43 groups applied, including yours. How many of those do you think stand a chance?
I think of course, all of them stand a chance, but I think that there's going to be 10 to 12 real applicants. And what I say by real applicants is they have the capital behind them. They have physician or scientific leadership. I think that there's going to be a strong preference for physician leadership, because that does keep the patient first. And they also, the biggest thing that people are going to run into is methodology development, and being able to, that's where people are going to fail on the timeline. And, it's, again, very different to have started a few dispensaries in Colorado or California, or even have done the processing there, versus developing specific formulated pharmaceuticals on a strict timeline. They're just very different beasts.
Okay. And then, so what do you think separates yourself, besides the experience in Minnesota, from some of these other applicants?
Yep. So there's several things that separate us, and one of them is separation science. So unlike many companies that are going to be strain dependent, where they have to breed a new plant to get a new medicine, we are very simply able to separate individual cannabinoids and other components of the plant, reinsert that into a whole plant extract, and then you have a very precisely controlled medication. So that's something that's pretty dramatic, a dramatic differentiator. Another thing is our environmental focus. We believe in the greenhouse model. We believe in water conservation, full hydroponic model, a lot of energy conservation methodologies. So that's something that's very important to us. We have an aggressive community outreach plan. We want these to be approachable by patients from a financial standpoint. And we will be donating 5% of all of our profits when they come to something called New York Canacare, which we hope will be a nonprofit, pending the IRS's input, which will help to offset the cost for patients in need. So in addition to the input that we put into New York CannaCare, there will be private and public donations that will be accepted too. And what I can say is these medications are not cheap. Your average patient is going to be spending between $200 and $400 a month to get the medication. Some patients have substantially more than that. So it's important to me as a physician that this is approachable for patients, but it also has to make sense from a business standpoint.
All right, well, this sounds exciting. I'm going to provide everybody with a link, obviously, to your website and how to contact you. But as we close out, is there anything else you'd like to add, Kyle?
Yeah, no, thank you for your interest. If you have interest in the True Medical model and want to be part of the team, we'd be very interested to talk to you. I do want to be clear that, we're not aggressively seeking out investment at this point, but if you think that you'd be a good fit for our team and have something to offer, we'd be excited to talk to you.
All right, well, good luck. I know you sound very confident that you're going to be one of the 5. I hope that works out for you, Kyle.
I really appreciate it. Thank you so much.
Okay.